Hi everybody, welcome to Wednesday Wisdom. For this week's episode, we are going to be talking about fibromyalgia syndrome. This is something that we see in clinic a lot. Lots of patients either having it pre-diagnosed or under investigation or having it in their family history. So we thought we would talk about it today, share our knowledge on the condition and obviously who you need to see to help. So fibromyalgia syndrome is a disease characterized by pain, stiffness and soreness of muscles, tendons and joints of the body without detectable inflammation. It's a widespread pain syndrome. It induces fatigue in 90% of the patients, and it's not just one condition, it's a complex syndrome. So lots of signs and symptoms accompany fibromyalgia syndrome. It affects typically about 4% of the population between the ages of 22 and 50. What we also find, it's a malfunctioning of the central nervous system. So it is characterized by central sensitization. And what this means, it's a heightened pain perception. So it's a heightened body response to processing pain and dealing with pain. So we find that we react to different stimuli, we react to pain receptions, and we're a lot more susceptible to having that widespread pain. What I also find is that it typically leads to dysregulation of different systems in the body. So what I find is it first of all affects the autonomic nervous system, which is your sympathetic and parasympathetic nervous systems. Your sympathetic nervous system is the fight or flight, so your response to different stimuli. Parasympathetic, I always think, is rest and digest. What happens is you get a heightened SNS response, so you get increased heart rate, increased breathing rates. What we typically find is it affects our digestive system, so how our GIT tract works, which is why patients suffering with fibromyalgia syndrome typically start to experience symptoms of IBS, respiratory, cardiac symptoms. So they tend to come on with that heightened SNS. What you also find is their immune response is different as well. So you find that their immune response changes. So what we're seeing is a normal response to a stimuli or inflammation or pain is incredibly heightened. So what you find is everything becomes a lot more sore, which is why we typically see that widespread ache and pain in the body. So it is typically characterized by different symptoms, and so there's some that are really common and other ones that come into play as well. But I think what makes it such a challenge to diagnose fibromyalgia syndrome is the symptoms are so vast and they're so widespread. Lots of different areas affected with this condition, which makes it such a challenge. One of the top things that we see is that muscle pain, those tender points around the body. And what you typically find is they're normally around the girdles of the body. So around the neck and the shoulders, around the hips, around the lower back, into the legs. You find it gets incredibly sore. They can also experience visual changes, mental and physical fatigue. So doing stuff day to day becomes a lot more of a challenge. They're a lot more tired when they're doing stuff. You find that you get stiffness in the joints as well. Again, going back to that pain perception and movement through the body. Everything becomes a lot more difficult. You're finding that you can get associated sleep disturbances and insomnia, cognitive behavioural changes, memory issues. We find we get irritable bowel syndrome. So the list just goes on and on of all the different stuff. But the idea is that there's a heightened sensitivity through all systems of the body with this. And so that is why the symptoms are so vast. To diagnose this is almost diagnosis of exclusion. So they look at other conditions first, rule them out, and then bring all the symptomology together to work out if this person has fibromyalgia. So what they typically do is lab testing, so blood tests, x-rays, imaging, to look for different conditions. They do look at the widespread pain index and severity scale, so they like to mark where the pain is on the body and how you're feeling and how you're processing pain. What you typically find is they tend to be more than 4 to 5 regions of the body, with the symptoms lasting typically around 3 months plus. So it's quite a prolonged condition with this. In terms of when it has been diagnosed and in terms of management, it's very, very challenging because they're still unsure of the main causes of fibromyalgia, and they're still researching this. They know risk factors, but they're still researching the main causes, which makes it incredibly difficult to treat and prevent. And so what they're looking at with the management is it's managing the pain and the symptoms that arise with that individual. So it's managing all of those symptoms like IBS, pain, movement restriction and fatigue. Some of the ones that have seemed to be a lot more effective from research is actually getting the person eating well, healthier lifestyles, moving is really important. They also saw manual lymphatic drainage as one of the things, limited evidence with hands-on treatment, but they're saying, you know, getting that movement through the body can be quite good, as well as cognitive behavioural therapy, so looking at other associated symptoms with fibromyalgia. So I've covered a lot today. Hopefully that was helpful. What we would normally do in clinic as osteopaths is, if we're considering this, we would always send clients off to get this diagnosed properly. This is something that maybe we could hypothesize or predict, but we would always want to refer them on to the most appropriate people to test for this via labs and specialists. So send them on, diagnosis of exclusion, and then get it sorted and managed properly. But yeah, hopefully that was helpful. Any other suggestions for Wednesday Wisdom, just comment underneath the video, and obviously you can answer any questions that you might have. But have a fab Wednesday.